intensive session, how quickly should they go through movement patterns and load themselves to now own that umbrella, for lack of a better term, to move better without getting hurt?
I don't think we know. I
Okay.
look. So let's say you come in and you have back pain, and the only thing that triggers it is sitting. You're like, I can work out and do whatever I want. It just hurts to sit. If we work on you and remove the protective guarding thing that you have that's caused from sitting, if you don't poke the bear and irritate it, do you need to load it right away afterwards when you feel good? You already feel good. And then if you don't irritate it 3 or 4 hours later and you want to go to the gym and you don't have an issue, you can do it whenever you want, just as long as you don't poke the bear. Now, if there's a deficiency and you want to prime something or get it activated, sure, you can go right to the gym and start doing some stuff. But if you go sit the wrong way and that triggered it, did all that priming and stuff right away help out? You might have just poked the bear again. So it doesn't help.
How often? No, that does. How often of poking the bear do you see it being some sort of disc herniation, either forward or backwards?
I think disc herniations are probably more common, the most common thing that comes into everybody's clinic with back pain. So I think Robin McKenzie's book talks about, who's a physical therapist, that you do McKenzie exercises. At least my interpretation of what I read from that book is the back is categorized in 3 different things. It's a derangement, which is a disc issue. I think a dysfunctional thing, which is like a gymnast or a football player that does extension stuff and they end range load and piss off a joint, like a facet joint, or it's a muscle spasm, which is something acute. Or no, it's postural syndrome, which is I sit for a while and I load my spine. I get an irritation from posture. So postural syndrome is you sit for a long period of time, you irritate it. Okay, that's easy to address. That's not really a major condition, but a disc issue can be debilitating. And then the dysfunctional pattern of a facet joint or a hyperextension from loading on a regular basis is more of the history of constant volume and irritating it. So I see disc issues, I think, all the time in my experience.
Without giving away your secret sauce, what do you do / what do you recommend to our listeners in terms of how to handle that? And then how to, I know we can't prevent injuries, but what are some good trends and good training that you've seen over your time to help that happen less often?
Looking at every back issue typically has a movement bias. So figuring out, just take your life and figure out what are the triggers. That's what I ask in a history. That's what any good clinician should ask, is how do we irritate it? Because if your back doesn't bother you let's take a typical patient that has a disc issue. It might or might not hurt to cough and sneeze. They often don't like to sit, but they do better with standing. So those are things you look at and you try and find their movement bias. So that person's often going to have trouble with leaning forward and they'll feel good leaning backwards. So if you find those triggers and you stay away from those triggers, you're going to feel better. And then I think the body wants to heal. So if you avoid those triggers, the body will want to heal, and it does a pretty good job. So really what I do is I intervene and just break it down and figure out what are the things that provoke it, educate you on how not to, and then treat you, do some soft tissue. This is the way I think about it. Do some soft tissue work, do some joint work. Let's get some blood flow to the system, which brings oxygen. Let's decrease the protective tone from you irritating it. And then I teach you how you were probably irritating it. So if I work on you, you get a better range of motion, you get decreased pain, then you don't poke the bear. And now we stack together a couple of days where we're not irritating it. I think the body does a good job of healing if it's not broken.
How do you not poke the bear if, like you said, it's gymnastics or football where they're required to do it, or it occurs so often in their sport?
Then I think it's having good relationships, like with somebody like you, and then saying, all right, the only recipe for overtraining or over volume is just to decrease it, and just have a discussion with the right parties and say, look, I can work on make you feel good, but this person keeps coming back with the same thing. And there's a history of they hurt their back always when they squat. Well, something's wrong in their squat. So then we have to talk with the strength coach and say, look, how can we still accomplish the task of making gains, but not irritating that? And that's just my approach.
Another saying that I've heard you say, in addition to don't poke the bear, is playing well in the sandbox. How do you recommend to our listeners out there, based off of your experience, how have you been able to play in the sandbox well with other people and other professionals to have the experiences that you've had over your career?
It's being at the university level and just having that experience of sports medicine, athletic trainer, strength coach, physical therapist, chiropractor, the athlete, and the head coach maybe, and knowing that everybody wants the program to succeed. And it's taking a step back and go, okay, how can I work together as a team and make that athlete a better athlete the next day, and just put your ego aside. And we all have something to learn from everyone. That's why I've spent years in the gym at Towson University. I like to work out, but I also want to learn from you guys. One of my deficiencies going into school or coming out of school, we didn't have a great skill set for physical therapy. So I spent some time taking what's called a diplomate in the physical therapy in rehab. And then I see rehab and performance is so intertwined. I wanted to see it from your standpoint of performance and getting good relationships with you guys, so we could have an honest discussion about it. And then learn from the athletic trainers, pick the brains of the sports med docs, seeing what it's like to see fractures or rule out certain things. It takes time.
How one of the things that athletic trainers have talked about in the past is the fact that, like you said, okay, even maybe progressions, regressions don't get taught as well, and periodization is periodizing and planning, your sessions as a chiropractor. Is that something that is typically done, or how does it go about on the day-to-day when somebody's coming in? You talk about the breakdown with the SFMA. What is the process like in terms of, okay, this is where we're at today, we're moving to this, based off of truly the day that they come in, and you have to just adjust on the fly, or how does that work?
It really comes in when that patient comes in. I don't know how they're going to present that day. So if I've seen them once or twice and their range is better, their pain is decreased, there are things that frequently triggers it or less, we're getting better. So depending on where they are, so we'll do a quick movement assessment, figure out their pain, figure out where they have troubles, and then determine what we're going to do there. If they have all those things, we migrate to something else. We might just do stuff in the gym, in the office, and just do rehab stuff or performance or priming.
Congratulations on making it to the end of the video. Why don't you celebrate by watching more videos just like it? You can also help us on our quest to placate the algorithm gods by liking, sharing, subscribing, and commenting. Thank you.